I go by Abby. I'm a proud mother of an 18-year-old boy who's on the autism spectrum. I identify myself as a multilingual family advocate for the community with developmental disabilities and as a first-generation immigrant. My leadership project is a community outreach study for Help Me Grow. The HRSA disclaimer. Almost 17% of the children between the ages of 3 to 17 in the United States were reported to have a developmental disability diagnosis between 2009 and 2017. Yet, less than 1/5 of those children receive early intervention services before 3 years of age. Developmental delay can be identified with reasonable accuracy using a validated screening tool. A study reported that only 48% of the pediatricians were using a standardized developmental screening tool in practice. The nation's first Help Me Grow system was launched in Hartford, Connecticut in 1997. It's a comprehensive and integrated national system designed to address the need for early identification of developmental behavioral concerns and to link children and their families to community-based developmental and behavioral services and supports. This LEN leadership project resonates with me personally. We lived in Hartford, Connecticut, which happens to be the birthplace of Help Me Grow. My son was diagnosed on the autism spectrum when he was almost 3 years of age. However, he had all the symptoms of autism as early as 14 months. And despite my concerns, we were not referred for an early screening. Parental concerns alone are often inadequate for identifying children with developmental delays. Community pediatric providers, they are in an ideal position to screen and refer young children for evaluation for developmental delay. However, there are multiple challenges to screening for developmental delays in routine clinical practice. In one study, 82% of primary care physicians cited ongoing time constraints as the most prominent barrier. Other barriers to screening include competing clinical demands, long waits for children to be seen by subspecialists, lack of available subspecialists for referral, staffing requirements, lack of consensus on the best screening tools, and lack of physician confidence in their training and ability to successfully manage children's behavioral and emotional issues. Additional barriers noted were high staff turnover with subsequent need for training in administration of the tools and lack of reimbursement. Ideally, children with developmental challenges are identified and referred for evaluation in early as possible to ensure timely access to intervention. However, many children are not screened properly, and sometimes those who screen positive are not referred for a needed evaluation. Early detection and connection to services lead to the best outcomes for children with developmental or behavioral challenges. Help Me Grow is a resource that connects families to existing community-based services. There's no eligibility criteria. However, how Help Me Grow works may not be clear to all who could benefit. Help Me Grow Yolo County approached the Mind Institute because they believe that they were underutilized and also under-recognized. The reasons for this underutilization are unclear. So building awareness of Help Me Grow and connecting with local providers to understand their needs with regards to screening will help us better understand how Help Me Grow YOLO can support them in meeting those needs. So with this information, this study set out with the following questions. Do local healthcare providers know about Help Me Grow? What do they know about Help Me Grow? Have they used? And what was their experience? How can we engage health providers to utilize Help Me Grow? So a short Help Me Grow specific survey was distributed to local providers. The link was emailed. The challenge was the survey was targeted to an audience who are less inclined to participate in surveys. Therefore, the intention was to keep it convenient and quick and thereby elicit as many responses as possible. This survey was compatible in phone, tablet, or a laptop and was intended to take less than 2 minutes to complete. We actually anticipated a poor response, and ENDS decided to do the study in 2 phases. Phase 1, which is this study, and possibly a phase 2 that can be conducted by a future LEN trainee. You'll see 2 maps. At the top, the red dots show the zip codes from where we actually got the responses from. The zip codes were shared by the respondents. Remember, this study was an anonymous survey link, and we did not track any identifying information other than what the participants voluntarily shared. In the below map, the red dots are the zip codes that fall under Yolo County. The study was targeted primarily to the family healthcare providers in the Yolo County, but only 15 respondents were actually from the Yolo County. There could have been more from the county, but not all respondents share their zip code, so we don't have that exact data. The very first question was, have you heard of Help Me Grow? Of the 42 responses we received, 38 answered this question. So 27 of them answered yes, they have heard of Help Me Grow. However, 11, that is almost 30% of the 38 respondents have not heard of Help Me Grow. Surprisingly, of the 42 who clicked the link for the survey, only 4 actually did not take the rest of the survey. This is definitely something we were thrilled about. The 27 who answered yes responded to this question. So we wanted to know if they knew about Help Me Grow, what services they were aware of, that Help Me Grow offers free of cost. As you see in this graph, there are services, these are the services offered free, but almost 50% of the respondents knew about developmental and social emotional screening. But Help Me Grow offers services way beyond the screening. One of the research questions was, is Help Me Grow under-recognized? 75% of the respondents were not aware of all the services offered by Help Me Grow. So if they knew what services were offered, did they use them? So here, 27 respondents who have heard of Help Me Grow, 24 of them replied. So 15 reported they have worked with Help Me Grow, and 9 reported that they've never worked with Help Me Grow. So if 9 knew about Help Me Grow but did not use them, what could be the reasons? So looking through the Qualtrics data, I realized that 4 of them who did not use it actually reported they didn't know what Help Me Grow offered. 3 of them knew only about the developmental screening and not the other services. These findings actually trigger us to ask, are the physicians not using Help Me Grow because they really don't know about Help Me Grow? This question and the findings are very significant considering the fact that this survey was sent out to predominantly to a contact list provided by Help Me Grow. That took us to the next question. If they indeed used Help Me Grow, did they find it useful? So of the 24 respondents, only 15 responded to this question, but a total of 11 respondents reported they found it extremely or very useful. And 4 respondents found it only moderately or slightly useful. So 73%, which means they've reported that they found it extremely or very useful. But the other 27%, which is actually represented by a small sample of 4. Out of this, actually 4, only 1 knew about all the services that Help Me Grow offers. The other 3 probably didn't find it useful enough since they didn't know about all the services. But this response sample of 4 is too small to draw that conclusion, but it is something considered for future studies. So we wanted to find out the scope of our phase 2 study if they were interested for a follow-up interview. Now 33 responded to this question, out of which 10 shared their contact information for a follow-up interview. Now, we wanted to understand if how can we have the providers utilize the services offered by Help Me Grow? Well, offering a free CME certification, maintenance certification to the staff help. Now, 32 participants responded to the question. 9 were interested, but only 8 actually share their contact information. So technically, it's only 25% who were interested in CME or certification. Now, 2 things I wanted to highlight. We did not mention that the credits were offered free, and also this was for their staff. The question was, are you interested in opportunities to get CME or maintenance of certification credits? In one of the previous slides, I showed a graph of all the services that Help Me Grow offers. For want of time, I'm unable to go in depth, but this is the universal model of Help Me Grow, how Help Me Grow offers the services. So overall, majority of providers, surveyors had heard of Help Me Grow, but there is still a large proportion that is even from their own mail list who have not. That is almost 30%. And 73% of those who reported found Help Me Grow extremely or very useful. Developmental and social emotional screenings were the most recognized services. 75% of the respondents were not aware of all the services offered by Help Me Grow. As I shared in the beginning of the presentation, an estimated 17% of the children in the United States have at least one developmental delay. Yet, less than 1/5 of those children receive early intervention services before 3 years of age. This means hundreds of thousands of children like my son miss out on the crucial early intervention. To explain the importance of early intervention, let me again share a very personal experience. My son, he had symptoms at 14 months, but we started receiving services when he was past 32 months. When we started the intervention, he was nonverbal. He had 0 words. In less than 2 months, with an intervention of less than 15 hours a week, he started speaking in sentences. There have been countless number of nights I've been wide awake and beating myself to sleep. Why did I not advocate enough and had him screened for the delays? However, as I said, parents' concerns are not just enough. And in fact, many a times parents wouldn't even know what to look for. Community pediatric providers are in an ideal position to screen and refer young children for evaluation for developmental delay. And organizations like Help Me Grow can help them provide these services free of cost. So future directions. We need more information about barriers and facilitators to Help Me Grow. Collecting qualitative data through email surveys is a challenge. Offering free CMEs may not help. So recommendations for phase 2, reach a wider audience, individual tele-interviews, focus groups with interested providers and their office managers, gift card rewards to participants, maybe. Finally, thanks to Aubin for offering me this opportunity to work on this leadership project. Thanks a bunch to Melina, who's here, for patiently working with us and always replying promptly to the numerous emails, and to all those participants who took the survey. And finally, I couldn't have done this project without Sarah, my mentor, who built the framework for the study, meeting me every week during the last few months and helping me with this leadership project that resonated with me on so many levels. And thank you, Maya. Thanks, everyone, for this presentation.
Hey, so I was starting to type in the chat and it's just taking me too long. My husband and I did the Incredible Years through Yolo County. And what I want to say is that it wasn't very sensitive to issues facing people from lower socioeconomic groups. And we had a lot of people drop out of the program. So I don't know if that resonates with what you observed or not, but that's what I observed.
Yes, Liz. So as I said, the challenge for this study was, the scope was so less because we were reaching out to service providers via an email survey. And so we've initially wanted to first understand the just the basic of how many would actually even respond. So this is definitely something because out of 25 respondents who actually reported, only 15 of them responded to how effective they were and how useful they found. So this is definitely something might happen with a more qualitative study, maybe reaching out in person or tele study. Does it help? Did it help to understand that question, Liz?
Yeah, thanks. I appreciate it.
Yeah, because as I said, out of this, it was less than a 2-minute study, and even then the response rate was minimal as it went further. More than for 1-minute survey, there were lesser responses.
If I may, this is Melina from First 5 YOLO. To answer the prior question, about language and lower socioeconomic statuses. We do offer lots of services via our community-based organizations who do outreach. So Help Me Grow is a collaborative of multiple agencies that work together to reach all of the children and families of different levels of different backgrounds and different languages. So it is increasingly, we are doing greater outreach to languages beyond Spanish, Farsi, Urdu, and other languages via these unique partnerships. So we are making headway there.
Thanks, Belina. Thank you.
Thank you, Abby, for a wonderful presentation. And thank you to all of our LEN presenters today. It's such a great pleasure to see the hard work that went into these and the culmination of this year's project. So really great job to everyone. I'm so proud of everyone on a very personal level, having worked with you all year. It's really emotional to see how all of this comes together. So thank you to all of our presenters. A big round of applause. I do want to take some time. We have a few minutes left. If you have any comments or questions for any of the presenters that went this morning, please feel free to put them in the chat or unmute yourselves to speak up.